in our last session we were discussed about enterectomy, okay, pulmonary embolism, enterectomy. So everything was discussed on our last session. Now we have to start from ECMO. ECMO means extracorporeal membrane oxygenation or extracorporeal life support. ECMO means extracorporeal membrane oxygenation. Excels extracorporeal life support. See that this is the image. So this is the image is used to externally insert the device for that means for heart. Externally insert the device for the supporting of heart. So here like a dialysis, when a patient has any heart failure, if a patient has suffered by heart failure means doctor externally attach the device for circulation. Here, if the device is attached with the vein to vein means go for 946. Vein to vein, go for 946. Vein to atrium, 947. Vein to vein, go for 946. Vein to atrium. Initiation means on the day of insertion. On the day of insertion, we should report 33947 for vein to atrial insertion, and for vein to vein insertion, go for attachment. Go for 947. And 48 and 49 for daily management. On the first day of insertion, we should apply the code of 46 and 47. 48 and 49 for daily management. On the daily basis, doctor just examine the device only. On the daily basis, doctors just examine the device only. For daily management each day. So guys, on the first day, we should report the code of 46 and 47. On the first day, we should report the code of 46 and 47. From the second day, we go for 48 and 49. From the second day, we go for 48 and 49. 48 for veno-venous 48, veno-atrial 49. Guys, did you understand the code section of from 46 to 49? Is there any confusion? Any confusion?
No, ma'am.
Okay. So today, doctor insert the device for a patient vein to vein. Did I text you? Today is the insertion day. Today, doctor initiate the device. Doctor initiate the device. Initiate the device. From the second day, third day, and fourth day, doctor just checking the function of the device. That is called as management. Daily management is nothing but doctor just checking the function of the device, whether it is work or is there any complication. That is, Manjusha, please mute yourself. Okay, so whether it is work or not. So daily management is nothing but doctor checking the function of the device. So that is called as daily management. Now, how can we report the code section for this scenario? So here the location is vein to vein, veno-venous. Veno-venous. Now what is the code section? Now 1 minute I will show you. What is the code section?
33946 and 33948 into 3.
Into 2. 33946. 33946 for first day. Then after first day, how many days are given here?
2 days.
3 days. Second day, third day, fourth day. 3 days. For the first day, we should report the code of 33946. So for the remaining 3 days, we just apply the code 3 times. 33948 into 3. Did you understand now? Guys, did you understand?
Yes.
On the first day, we should report 33946. For the second day, third day, and fourth day, we should report 33948 and 48 into 3 because there are 3 days. Okay, beyond first day, there are 3 days or 3 days give a management summary. 33948 into 3. Any doubt? Any question? Any doubt? Now, check that. What type of device is inserted here? Check that. 33951. What type of device is inserted here? Insertion of? Peripheral cannula. Super. For insertion of peripheral cannula, the approach is percutaneous approach. Birth through fire. If a patient ages, birth through fire of patient age, go for 51. 6 year and older, go for 52. So, inserting of peripheral cannula. Insertion of peripheral cannula. So, for birth through fire of patient age, 51. 6 year and older, 52. Now, check that. What is the code section of 33953? Double 3953.
Open.
Procedure. Procedure is same. Insertion of peripheral cannula, but approach is different. Procedure is same. Insertion of peripheral cannula, but approach is different. The above code section for percutaneous approach and 53 and 54 for open approach. Open, birth through 5 year 53, then 5 year or older, 6 year and older, 954. Now check that the procedure of 55. What is the procedure?
Insertion of central cannula.
Insertion of central cannula. Super. So the above 4 code section for insertion of peripheral cannula, then the below 2 code section for insertion of central cannula. Same like that. Central cannula, birth through fire of patient age 55, 6 year and older 56. And 57 and 58 for repositioning of peripheral cannula. So the device has slipped, moved from its original location. So the device has moved from its original location. So that's why doctor make a procedure. To relocate the device at the proper position. So to relocate the device at the proper position. Same like that. Birth through 5 year of patient age 57, 6 year and older 58. So repositioning of peripheral cannula. So here that is a key term. Reposition of peripheral cannula is a key term. For birth through 5 year of patient age 57, 6 year and older 58. That's it. Now all of these code sections are given in a flow chart. So the above 2 code section for initiation of ECMO device 46 and 47, 48 and 49 for the subsequent day for daily management code. These 4 code section for ECMO excels and cannula insertion. So same like that. Based on the approach, Based on the patient age, the core sections are classified here. Based on the approach, based on the procedure, patient age, the core sections are classified here. Cannula insertion procedure percutaneous, birth through fire 33951, 33952. Open approach, birth through fire 53 and 54. Sternotomy or thoracotomy, that is the it's one of like a open surgery 55 and 56. So the above core section for inserting of catheter, select the appropriate code here. Then the last one is other cannula procedure. That means along with the above code section, if a provider also perform these three procedures, means we can apply the code. So for atrial exposure, along with the cannula procedure, if doctors also perform the atrial exposure, means we should report 33987. So insertion of left heart ventricle, we will discuss later. 33988 for insertion of ventricular device. For removal of the device, go for 988. So these three code section can able to report along with the cannula procedure. That's it. So the informations are given in the flowchart. Any doubt? What are the things we have to verify before you are going to report the code for cannula?
Approach and patient age.
First, you have to check the approach. Percutaneous, open or thoracotomy. Next,
Age of the patient.
age of the patient. Okay, patient age. That's it. Bad. Ventricular assist device. Very, very, very important question. So this is one of the very, very important. Ventricular assisted device. VAD. VAD. So in ventricular assisted device, we have two classification. Yes, Ashik. Yes. Assisted device, they have two classification. Extracorporeal and intracorporeal. In ventricular assisted device, we have two classification, extracorporeal and intracorporeal. Extracorporeal means the device has inserted internally as well as externally. Intracorporeal means the complete device has present inside of our body only. The complete device has present inside of our body only. That is intracorporeal. Did you understand? So first you have to check whether the device has inserted internally or externally. That means for extracorporeal means the device has inserted internal to external. So in that single ventricle 75, biventricle 76. For the inserting of extracorporeal device 75 and 76. For removal of device 77 and 78. 79 and 80. 79 for insertion of intracorporeal. The above code section for extracorporeal. Like 79 code section for intracorporeal, 80 for removal, 81 for replacement. Now check that for 33981. For 33981, is this a device is a intracorporeal or extracorporeal?
Extracorporeal. Extracorporeal.
So, okay. So for replacement of extracorporeal means go for 33981. Okay. Any doubt? Okay. Then arteries and the veins. Arteries. So arteries. Next 1 minute. that does not has a wall, but a vein that has a walls. See that this is a walls. Vein only that has a walls, but in artery we do not have a walls. Okay. So this is valves does not close properly, that lead us to the varicose vein. Okay, varicose vein. So this is just a information. Then what is the meaning of embolism? Embolism.
Immovable blood clot.
Movable blood clot. Embolism means movable blood clot. So removal of ectomy means removal. Remove the movable blood clot. Or thrombectomy means removal of blood clot. Thrombectomy means removal of blood clot. Embolectomy means removal of movable blood clot. So same like that. For neck incision 34001. So the locations. So here this is the exact location of the embolism or thrombus. If the embolism or thrombus that are present at the carotid subclavian innominate artery, for neck incision 01, thoracic incision 51, for arm incision 101. So these are the key term. Underline that neck incision is the key term for 01. Thoracic incision is the key term for 51. Arm incision is the key term for 101. Arm incision is the key term for 101. Then embolectomy, removal of embolism. In that previous book, the procedures are performed at the arteries. Procedures are performed at artery, atrium. So here thrombus means here these are the procedures are performed at the vein, venous. For venous thrombectomy, same like that, arm incision, that is the key term. So these are the core section for venous. For abdominal incision 01, leg incision 21, abdominal and leg incision 51, neck incision 71, arm incision 90. So these are the core section for venous. So the procedure is removal of thrombus. Procedure is removal of thrombus from vein. According to the incision, we have to select the appropriate core section here. Valvuloplasty, repair of valve from femoral vein 501. Reconstruction of vena cava 502. For transposition surgery. So venous valve transposition surgery 510. Cross vein graft 520. Sphenopopliteal vein anastomosis 530. These are the direct coding. These are the procedure of venous reconstruction. What is the meaning of anastomosis?
Joining.
Joining. Doctors make a connection between saphenous and the popliteal vein. So this is a code for grafting, vein grafting. 1 minute. I think everybody know that grafting. 1 minute, I should. Vein graft. 1 minute, I'll show you the image. So I think everybody know that this is a grafting procedure, vein graft. Exact images. See that grafting. Okay, harvest from one location and place in the another location. Harvest from one location, from upper extremity or the bypass graft is also the one of the graft. Harvesting from upper extremity or lower extremity and make a connection in the coronary. So grafting. So for venous graft, go for 520. 20. For valve transposition, 1 minute, I showed you. Venous valve transposition. The V key is not working properly. Venous valve transposition. Might as well. This is a abnormalities that are present at the vein wall. So transposition means there is that. So see that like that. Okay, transposition. So alternative route. Doctor creating a alternative route for them. Okay, for transposition surgery. Okay. Okay, guys, did you understand the procedures now? Did you understand the procedures? Okay. Valvular flaccid means doctor just make a suture. Suture at the wall, go for 50. That's it. Then, what is the meaning of enterectomy? Enterectomy. I told in our last class.
Removal of inner line of artery.
Super. Remove the inner line of, that is called as enterectomy. Remove the inner lining of artery, that is called as enterectomy. So thromboenterectomy means like that. So doctor remove the plaque. Plaque means that is thrombus, as well as remove the inner lining of artery. So same like that through the neck incision. The procedure is thromboenterectomy. That is the procedure. In previous section also, this is an embolectomy or thrombectomy. Then at embolectomy, thrombectomy at the artery, thrombectomy at the vein. Now, these are the code section for thromboenterectomy at the artery. Okay, thromboenterectomy, carotid, vertebral or subclavian artery through the neck incision 301. So the corresponding incision is our corresponding key term here. So for neck incision 301, if the thromboenterectomy procedure is performed at the location of performed at the location of femoral artery 302, popliteal artery 303, tibio-peroneal trunk artery. So that present at from tibial to peroneal. For tibio-peroneal trunk artery 304, tibial or this is a tibio-peroneal artery. 305, 306 for tibial or peroneal artery. Tibial or peroneal artery. Initial vessel 305, each additional tibial or peroneal artery 306. So 305 for initial vessel. 306 for each additional tibial or peroneal artery, go for 306. Now, how would you report the code for 5 tibial artery? 5. 5 tibial artery.
35305. 35306
That
into
is
4. 35306 into 4.
Super. 35305, 35306 into 4. That's it. Okay. That's it. Direct coding. So the procedure is thromboenterectomy. Then see that this is a grafting. So our harvest the arteries are vein from upper or lower extremity, and doctor make a creation of alternative route. So this is a grafting. So harvesting of artery from upper extremity 35600, for grafting 3557. For grafting 3557. vascular injection procedure. So here, first we have to check the procedure, next we have to check the location. Now the procedure is introduction of needle or catheter. So introduction, insertion, implantation means inserting of device. Introduction, implantation, insertion. That means inserting of device. Inserting of device. Introduction, implantation, insertion. So that means inserting of device. Inserting of device. So here, doctor introduction of needle or catheter. That means doctor insert needle or catheter in vein 36000. Inserting of needle or catheter in vein 36000. Shilpa, please mute yourself. Yeah. Guys, please mute yourself. If you have any doubt, unmute it. So 36002 for injection procedure. So the procedure is injection. So the anatomical location is extremity. What is the reason for pseudo-aneurysm? For pseudo-aneurysm, underline that is the key term. So injection is given for extremity pseudo-aneurysm 36002. 36002 for pseudo-aneurysm. 36005 for injection procedure for venography. Now here we have to analyze the procedure. What is the reason for that procedure? Here injection is given for venography 05. If injection is given for pseudo-aneurysm 02. And 36010 for introduction of catheter. Doctor insert the catheter in superior or inferior vena cava, go for 63010. So doctor, if a catheter inserted to the vein, go for 36000. Suppose if a provider insert the catheter at a superior or inferior vena cava, go for 36010. 36010. Did you understand? Any doubt in these four core section?
No, ma'am.
Now we are going to discuss about selective catheterization and non-selective catheterization. In that selective, we have a core section for first order, second order, beyond the third order. So like that. So before that, what is the difference for selective and non-selective? In catheterization, we have, that means catheterization means nothing but inserting of catheter into the aorta, in aorta. Actually, if the non-selective means, for non-selective, if the catheter entry site is aorta. Aorta means that is non-selective. If the entry site of catheter, if a entry site of the catheter is aorta means that is non-selective. Selective means if the entry site of the catheter is is a particular artery or vein. Particular artery or vein means that is selective. If I see that the image, if the catheter directly entry site, if the entry site of the catheter is aorta means that is non-selective. If a catheter enter into the particular artery or vein, example, right vertebral, right cervical, common carotid. So like that, if a doctor choose any particular artery or vein, but the catheter is going to insert through the aorta only. But based on the entry site only, here we are classifying the catheter is a selective or non-selective. If the catheter entry site is aorta means that is non-selective. If the catheter entry site is a particular artery or vein means that is selective. Take a note. Thus the meeting will going to end less than 1 minute. So rejoin by the same link. At the time I have to go restroom. So please wait. Please stay on the line. I will back. I just join you in that session. Please everybody join and take them.
Yes, ma'am.
So if I entry site of the catheter is aorta means that is non-selective. So suppose if the catheter is enter into the particular artery or vein means that is selective. Okay, now see that what is the meaning of order corresponding. So the main branch from aorta, that is the first order. See that the violet color that indicate the first order. Order means the main branch, the first branch from aorta, that is first order. The violet color that are indicate the first order. Then sub branches of main branch is second order. Then sub branches of branch, that is the third order. So the corresponding branch, main branch is the first order, sub branch is the second order, then sub branches of sub branch, that is third order. Did you understand? Did you understand? Guys, am I audible?
Yes, ma'am.
Now, how do we find the corresponding order? Means, so that is present in our appendix L. In appendix L, corresponding vascular families are present. By using of this vascular family, we can able to report the code for the corresponding order. Now check that internal carotid is the first order or second order or third order. Internal carotid.
Third order.
So internal carotid is a third order. Now right lingual is a
Beyond the third order.
beyond the third order. Okay. A right lingual, right facial. Right A means anterior. Right anterior cerebral artery. Right posterior communicating artery. These are the beyond the third order. Beyond the third order. Okay.
And this chart is there in CPT book, ma'am?
Yes. This alphabet appendix L is present in our CPT book also. Okay. Good. 215 is a selective. If you are going to select a code by using of this alphabet appendix L means these are the selective catheterization code. If you are going to select any of the code by using of this appendix L means that is selective catheterization. Am I right? Because if a provider if a surgeon insert the catheter through a particular artery or vein means that is selective. Okay. For selective catheterization only we have a corresponding. For selective catheterization only we have a corresponding order. So based on the entry side, first you have to check whether the catheter is selective or non-selective. Based on the entry side, first you have to check whether the catheter is selective or non-selective. Then based on the termination point, you have to select the appropriate order. So catheter enter through the innominate artery and terminate at the right internal carotid vein. That is the third order. Who's that? If a catheter enter into the innominate artery and terminate at the right internal means, you have to report the corresponding third order. So this is the way you have to select the corresponding order. Now, see that these are the code section. Selective catheter placement for thoracic brachiocephalic branch. For first order 215, second order 216. Here 217 is for both third order and beyond the third order. For third order and the beyond the third order, we have to report the code of 36217. Third order and beyond the third order, that comes under the same category. And 36218 for additional second order, third order or beyond the third order. How would you report this Adam code means? For example, 1 minute. Doctor insert 3 catheter through innominate artery. Okay. Doctor insert 3 catheter through innominate artery. 1 catheter that terminate at right ophthalmic. Another that terminate at right posterior communicating. Then the another catheter that is terminate at middle cerebral artery. Now, how many termination here?
3.
3 termination. All that are present under the branches of
Beyond
the third order.
third order.
So there are 3 termination. So for the first, for example, for the first one, you go for the primary code. Okay. So this is abdominal and pelvic. 1 minute. I just take this one. But because this is a core section for thoracic and brachiocephalic. For my explanation, I just take this core section. So there are 3 termination. All type of codes, all type of order that are terminate at the beyond the third order. So for first one, you go for 36217. Then the remaining 2, you go for 36218 into 2. Because 36217 for both third order and beyond the third order. Am I right? So there are 3 termination. For first one, 36217. Then the remaining 2, 36218 into 2. Did you understand? Did you understand, guys?
Yes, ma'am.
It is answering.
Okay, for each additional third order, second order, and beyond the third order, we have to report the standard code 36218. For single termination, we have to report the corresponding primary code. For each additional, you go for 36218. Here we have only one code for non-selective. 36221 for non-selective. Okay. Now check that the selective catheterization for common carotid innominate artery. Okay, so the above code section for thoracic or brachiocephalic. Am I right? Thoracic or brachiocephalic. Then the previous code section for thoracic and brachiocephalic. Now these code section for common carotid and innominate artery, like that. So these code section for abdominal, pelvic, lower extremity. You have to check, first of all, you have to check the entry site. So our primary code 36245. This is always our entry site. This is a entry site, first order, second order, third order, and beyond the third order, and the corresponding additional termination we should report 36240. That's it. Now try this question. What vascular order branch, that is internal carotid, for starting and appointed the catheter. So every catheter that enter into the aorta, but here we have to identify the entry site. So what is the order of right internal carotid?
Third order.
Third order. See that. Right internal carotid is a third order. Go for third order. Did you understand? Did you understand, guys?
Yes, ma'am.
Now I just give one more example for you. After that I will explain these concepts. Now try this question. 1 minute. I test you. Now try this question. What is the answer?
Option D.
Option A. Others?
And B.
B, ma'am.
B.
B or D?
B.
B. Okay. Actually, check that. 36247 is the correct answer. But check the code description of 75716. So 75716 for bilateral. 76710 for unilateral angiogram. Unilateral. Check that. So here angiogram is performed either right.
Option B. Only one side is.
Yeah, option D. Because 36247. What is the code description of 36247? 362, I think I have to open it. 1 minute.
Wait, man. Wait.
1 minute. Please wait.
What is an initial third order organ most likely abdominal lower extremity artery range within a venous tract?
36. What is the code description? 36?
36247.
247.
Page number 298.
Okay. Thank you. This is an intended code. We have to start from that. Selective catheter placement, atrial system, initial, third order or more selective catheter, abdominal, pelvic, lower extremity. Check that. First of all, you have to check the location. If the location must be abdominal, pelvic or lower extremity. Check that. This is a lower extremity. Am I right?
Yes,
Femoral
ma'am.
artery. It is placed in the femoral artery. That means this is a lower extremity. Okay, that is correct. But what about the 36217? I think 36217 for thoracic. Am I right? Yeah. 36217 for thoracic or brachiocephalic. So the locations are different. So 36217 for thoracic or brachiocephalic. But here catheter, the procedure is performed at the lower extremity. So that's why option 36247 is correct. 36217 is a thoracic or brachiocephalic. But the catheter is placed at the lower extremity. That's why option A and C are ruled out. Now the option will be 36247 and option B or D. And 76717 for angiogram bilateral. Am I right?
Unilateral, ma'am. Unilateral, ma'am.
Unilateral. Oh, okay. 75716. 1 minute, I check that. 75716. Angiogram 7576 716. Angiogram extremity bilateral. Sorry. 76716 for bilateral. Angiogram extremity bilateral. Now, but in this question, dye was injected and select left lower extremity angiogram was performed. Now, doctor just take the angiogram at the right side only. Okay, doctor just take the angiogram at the right side. Relieved a patency of common femoral profound femoris. Catheter was manipulated in the femoral artery, which is selected lower extremity angiogram was performed. And which was revealed occlusion from the popliteal peroneal artery. Okay, so actually, doctor take the angiogram at the right side only. Right side only. That's why this is not a bilateral. Angiogram is not taken at both right and left. Right side only, doctor take the angiogram. That's why 75716 for bilateral, 710 for unilateral. So that's why option D is the correct answer. 36247 75710 is the code of unilateral angiogram. Okay.
Yes, ma'am.
Did you understand? Then what is the termination site of catheter here? What is the termination site?
External iliac, ma'am.
Is it advanced into the
External iliac.
Right.
right iliac system advancing into the external iliac? Not external iliac. 1 minute, I checked that appendix here. Appendix cell page number. You look also. It's a Gerard's appendix cell 965. Actually, that is a common femoral. Actually, 965. 965, am I right? Page number.
$965 is for Appendix A, ma'am, not Appendix L.
Actually, here, it is 2023. This PDF is a 2020. Very dark. One minute, I check with my book. After that, I will show you. So that is common femoral.
Ma'am, I think it's second order, ma'am, external iliac.
1 minute. No. External iliac, in that external, second order. Yeah. External iliac, in that external, 1 minute. External. Check that the code description, it's also support for 36245.7. What is the code description? 360 is a second order or third order? 36247. Verify the code description. Sometimes the option will wrong. So that's why I have to. 36247. Third order are more selective. Okay. Actually, external iliac, so lower extremity. So you have to check under the superficial femoral that comes under the third order. I can't able to show this page. 1 minute, I just take the image and share you in our WhatsApp. 1 minute, guys. Actually, I have a color xerox of that appendix. 1 minute, I share you. Common acroform, which is relieved patency of common femoral and profound femoris. One minute, I check the second order and common femoral, and finally at reach the popliteal, because which is a rebuild accretion from popliteal. So popliteal means that is go for beyond the third order. Actually, here common femoral is also a common femoral. Beyond that, they are taking the accretion. They are find out the accretion at the popliteal during the angiogram. So that's why that is a third order. Third order. Did you understand? Well, guys, actually I missed that page. 1 minute, I share you. Common femoral because patency is revealed at a common femoral, profound femoris, and a catheter was manipulated in the femoral artery, which is a selected catheterization. So see that the popliteal that comes under the third order and the beyond the third order. That's why here we are reporting the code for third order. Did you understand now? Did you understand? Guys, am I audible?
Yes, ma'am, I understand.
Yes, ma'am.
So, 1 minute.
Ma'am,
Yes.
ma'am, can you explain which is the entry point here?
Actually, catheter is placed in the common femoral artery through the retroverted portion, which is directed into the right iliac system, advancing into the, actually, they are selecting the common lower extremity, approaching the lower extremity. Okay, common femoral artery.
But the common femoral artery is in the second order, right, ma'am?
Second order. Beyond that, they are finally reached that because external iliac as well as common femoral artery that comes under the second order. Am I right?
Yes, ma'am.
At last, they are reach the popliteal artery. In that location also, they will take one more angiogram.
So, should we use the initiation point or the end point here, ma'am?
End point.
Okay.
So based on the final destination only, we have to select the code section. Okay. Do you understand? Finally, the catheter that reached the popliteal. So that's why we are considered as seeing the beyond the third order. Okay. Did you understand now?
Yes, ma'am.
Okay. So the next thing is, 1 minute, so that is an example. Now we are going to discuss about the previous thing. Okay. Now, so here this is a vein puncture. See that the image, this is a vein puncture. So collecting the blood from vein. Collecting the blood sample from vein puncture for younger than 3 years. 36400 vein puncture younger than 3 years. If a patient age is younger than 3 years, but not, that means usually this vein puncture procedure usually taken by the nurse only. So physician skill is not necessary. Suppose a physician skill is necessary to complete the procedure. So these are the code section for doctors. These are the section for doctors. Suppose if a nurse will collect the blood sample means go for 36415. 36415 for collecting the blood sample. Collecting the blood sample by nurse. From 36400 to 36410 for collecting the blood sample by providers, doctors. So that means a nurse can't be able to collect the blood sample due to patient age or due to patient health condition. So in that case, doctors come to meet the patient and collect the blood sample means go for from 400 to 410. So vein puncture. So if collecting the blood sample from femoral or jugular vein 400, scalp vein 405. Apart from that vein, for any other vein means go for 406. Guys, if a provider collecting the blood sample from femoral or jugular vein, go for 400. For scalp vein means go for 405. Then 406, apart from these vein, for any other vein, if a doctor collecting the blood sample from any other vein means go for 406. So the above code section for if a patient age is younger than 3 years, 400, 405 and 406. 410 for 3 year or older. 410 for 3 year and older go for 417. Did you understand? Any doubt? Any doubt?
No, ma'am.
Okay. Now, we are going to discuss about central venous catheter, CACC, and peripherally inserted catheter. So, centrally inserted central venous catheter means that is SIC. It's also called a SIC catheter. Please take a note. CACC means centrally inserted central venous catheter. Centrally inserted central venous catheter, that is CACC. Peripherally inserted means that is PICC. For centrally inserted central venous catheter, that is SIC. PIC means PICC, peripherally inserted central venous catheter. See that if the entry site is subclavian, femoral vein, inferior.
Ma'am, your voice is breaking, ma'am.
Audible? Okay. So if the entry site of the catheter is jugular, subclavian, femoral vein, inferior vena, SIC. For peripherally inserted, basilic, cephalic, cephalous vein graft. These are the entry site for PIC. Basilic, cephalic, cephalous vein. These are the entry site for PIC. By using of this entry site, you have to find out whether the catheter is SIC or PIC. Next, tunneled, non-tunneled. Tunneled, take a note. Tunneled catheter usually inserted by the provider for temporary purpose. For temporary purpose, doctor will use non-tunneled catheter. Tunneled means for permanent purpose. If a
Ma'am, your voice is
insert the
breaking.
catheter for permanent purpose means go for tunnel. Non-tunnel, temporary. Tunnel, permanent basis. So for SIC, centrally inserted central venous catheter, non-tunnel, younger than 5 years of patient age, 36555. 5 years and older, 36556. 36556 for 5 years and older. Now see, these are the code section for tunneled SIC. Centrally inserted central venous catheter. Without the pump or port. Underline that. Without pump or port. Younger than 5 years, 57. 5 years and older, 58. Without a port or pump. Younger than 5 years, 57. 5 years and older, 58. Okay, see that. This is a port. Then 36560. Insert of tunneled catheter SIC but port with the port. The above two code section for without port or pump. Then 60 and 61 for with the port. Younger than 5 years 60, 5 years and older 61. Did you understand, guys? Did you understand?
Yes, ma'am.
Yes, ma'am.
Okay. Then see that 363 for with the pump, SIC, centrally inserted central venous catheter. The above two port for without the port or pump, then the below code section for with the port and with the pump. You just check, first you have to check whether the catheter is tunneled or non-tunneled. Next you have to check, first the catheter is SIC or PIC, next tunneled or non-tunneled, then port or pump gauge, then port or pump is inserted or not. Then 36565 for inserting of SIC catheter via two separate access sites. So two catheter inserted via two separate access. Because, so see that these are the entry site of SIC, am I right? One catheter inserted through jugular, Another catheter inserted through the subclavian. One catheter that inserted through jugular, then the another catheter that inserted through subclavian. So two catheter inserted via two separate access site. So without port R pump 65, with the port 66. Without a port R pump 65, with the port 66. Then these are the same like that. These are the picker with the port R pump 66. So all of these port sections are pick. Port section are the big two port section with ports.
Ma'am, your voice is not clear, ma'am.
Port are these are the port section for pick. The above two port section without port R pump, then the below two port section for with the port. Did you understand, guys? Did you understand? Hello?
Yes, ma'am.
Guys, am I audible?
Yes, ma'am.
Guys, very important. Very important, but a very direct coding. First, you have to check whether the catheter is sick or pick. Next, you have to check tunneled or non-tunnel. Then next, you have to check a patient age without a port or without a pump. With or without a pump, with or without port. Please take a key term. I will share this question at the end of the session. 1 minute.
Can you show report side, ma'am?
Please take a note first. This question in our next session. Okay. First, I just complete the topic chapter. After that, if we have a time means I will show you. Otherwise, I will share this question on our next session. Okay. This also. Okay. First, I just complete the session. Now, ligation. What is the meaning of ligation? Ligation means joining. Take a note. Joining. So, ligation means joining. So, ligation of internal jugular. Joining of internal jugular vein 65. External carotid artery 600. Then 605 for internal and common. Doctor make a connection between internal and common carotid 605. For connecting the internal and common carotid, for gradual occlusion means 606. So gradual occlusion is the key term. Gradual occlusion is the key term. Then ligation of atriovenous fistula, that is a key term for 607. So atriovenous fistula is the key term for 607. Ligation of temporal artery 609. So temporal artery is a key term. Ligation of major artery at the neck 615, that is a key term. Chest 616, abdomen 617, extremity 618. So these are the port section for ligating. That means connection of arteries and vein. It's a direct coding, no guidance here. Next, spleenectomy. Removal of spleen. For total removal of spleen, 100. Partial removal of spleen, 101. For total removal of spleen, 100. Partial removal of spleen 101. Now, what is the meaning of 102? What is the meaning of 102?
Just another question.
Yeah, super. Yeah, super. So total removal of spleen. That means doctor remove the spleen with another major procedure. Total removal of spleen with another major procedure. Okay. 102. Did you understand the meaning?
Yes, ma'am.
Then bone marrow. So hematopoietic progenitor cell, that is nothing but bone marrow cell. So transplantation of bone marrow cell, and the doctor freeze the cell and stored it. Cryo means cold preservation. Doctor harvest the cell and freeze the cell, and storage means go for 207. Then thawing means melting. Take a meaning of thawing. Thawing means melting. Melting the frozen harvested without washing technique. So doctor use any other technique. For without washing technique 208, with the washing technique 209. So thawing means melting. During transplantation, doctor melt the frozen harvest, and after that he may perform the procedure of transplantation. So without washing is the key term for 208. With the washing is the key term for 209. And 210 for T cell depletion. Depletion means separation. Separate the cell. For T cell depletion, so for T cell depletion, tumor cell. So tumor cell depletion 211. T cell depletion 210. So 210 for T cell depletion, tumor cell depletion 211, and red blood cell removal 212. Red blood cell removal 212. Did you understand?
Yes, ma'am.
Yes, ma'am.
Depletion means separation. And drainage. So drainage means surgeon make a cut and drain the fluid. So drainage of lymphadenoiditis. Drainage procedure is performed at lymph node for a simple 300, extensive 305. For simple 300, for extensive 305. Then 308 for lymphangiectomy. Doctor make a cut on the lymph node. For lymphangiectomy, that is a key term, go for 308. So suture. So lymphangiectomy is a key term for 308. Then 308 for suture. Doctor just make a suture. Okay, doctor just make a suture. Or doctor connecting the thoracic duct through cervical approach 80, thoracic approach 81, abdominal approach 82. Ligation, joining of thoracic duct. So through the cervical approach 80, cervical, thoracic 81, abdominal approach 82. That's it. Then mediastinotomy. So tomy means cut. Surgeon make a cut on the mediastinum. Mediastinum is nothing but spaces between two vertebrae. Spaces between two vertebrae. So with the exploration, what is the meaning of exploration?
Examination.
Exactly. Doctor make a cut on the mediastinum. What is it for the reason of exploration, or drainage, or remove the foreign body, or biopsy? For through cervical approach 39000, thoracic approach 39010. For cervical approach, that is a key term for 39000. Thoracic approach means 39010. Okay, that's it. So chapter, the next laceration of diaphragm. Doctor make a suture. Repair means suture. Doctor make a suture for laceration 501. So 503 for the procedure is treatment of diaphragmatic hernia. Diaphragmatic hernia, for the treatment of diaphragmatic hernia, for neonatal 503. So up to 28 days, birth through following 28 days, people only we can apply 503. From 29th day or older, go for 40, acute. For chronic, 41. So birth through following 28 days, patient only we can apply 503. From 29th day or older, go for 540. In that acute 40, chronic 40. Did you understand? Did you understand the concept?
Yes, ma'am.
So try this one. The procedure is the mediastenotomy. So the approach is cervical or thoracic, guys?
Cervical.
Cervical approach, go for 3977. That's it. Any doubt? Any question? Chapter over. Any question? Any question? Okay. I will share these two questions in our next session. Okay. These two. Actually, we already discussed this question. I will share this one under this one in our next session. Okay.
Ma'am, also provide more questions for
Give them access to open that application.